Hello everyone, my name is Dr. Aditya Gupta. I'm MBBS, MD, and DM, and I did all. I'm doing my DM in pediatric oncology from AIMS New Delhi, and I did my MBBS and MD from AIMS New Delhi, and did my MD in pediatrics. So this is the for all those who have just recently got their marks and are wondering about what to do and what not to do. This is a video for MDMS versus DNB, the hot topic, the hot debate. I'll focus and try to restrict myself to two fields that I know, my own pediatrics and for radio diagnosis, because my best friend is doing radio diagnosis. Now, first thing first, okay, MD and DNB, although they have been equalized by the government, MD is definitely, I'll be very blunt, is definitely preferred over DNB. There are multiple reasons for that, and you should know the reasons why MD is preferred over DNB. The first is the public perception. That's the reason you are asking this question in the first place. If MD was equivalent to DNB, you wouldn't be asking, should I do DNB in this or should I do MD in that, right? The reason is because you know that MD somehow, the perception is that MD is better than DNB. So yes, definitely the perception part is there. Second, DNB is mostly done in corporate hospitals. So there is the point of fees. Certain times their fees are slightly on the higher aspect as compared to certain government medical colleges. Second, since they don't have a medical college attached, the academics tend to be of lower quality as compared to that of a MD college, and they are known to have a lower pass percentage. At the end of doing your 3 years of MD, you can be reasonably certain that they will be passed because you have worked there at those 3 years. The examiners are you working with your familiars. They're your own professors with whom you have worked for 3 years. The pass percentage of MDMS is pretty high versus the DNB pass percentage, which is low. Even after doing hard work for 3 years, if you don't know that whether you're going to pass or not because your academics have suffered because it's a corporate hospital or it's a private sector, you obviously will be a little jittery to join that particular course. Having said that, I'll also say that MD is almost equivalent to DNB, or DNB is almost equivalent to MD, or actually sometimes exactly same. There's no difference, especially if the DNB is in a government sector or in a private hospital that is well recognized and well known for academics. Now, what are these private hospitals and these government sectors? I'll come to them a little later. One distinct disadvantage as far as DNB is concerned, always remember, this is one reason why DNB will always be slightly less as compared to MD, is because as far as teaching jobs is concerned, see, if somebody wants to become a professor at a college, I do not have an interest in private practice. Right now, around the government services provided, around 40% of the doctors are employed by the government sector. If you have an interest in the government sector, you want to become a professor at a medical college, then DNB is at a distinct disadvantage. Until and unless there are only a few criteria which have to be met by the DNB. The hospital should be more than 500 bedded, should have a full running program. Only then is DNB considered equivalent to MD. Otherwise, DNB people have to do an extra year of SRship or 2 years of SRship depending upon where they did their DNB form. You can find these details in the government notification. I won't go into the details, but the point is that DNB definitely have a certain disadvantage, especially as far as teaching job, as far as becoming a professor is concerned. But like I said, the other disadvantages are that since they have poorer academics and they have less pass percentage, these are the disadvantages as far as DNB concerned. But these are the disadvantages. What if a place does not have these disadvantages? This is where the concept of choosing particular subjects is concerned. DNB is definitely a decent or a good enough an option for medical subjects. That is your radio, medicine, peds, anesthesia. For these subjects, you can definitely consider or even choose DNB and over an MD. As compared to let's say surgery. In surgery, it's obviously, I'll try, please avoid until unless you have a first hand information that they will provide you surgery, they will give you hands-on experience. Corporate hospitals, they are run by proper doctors who have professional experience, and they themselves will be providing doing the surgery. They won't give you a hands-on experience that you distinctly require for a surgery. But for these medical branches, this is not a disadvantage. And in this scenario, you can actually consider doing DNB at a private hospital, a big corporate hospital, or a government hospital. Now, like I said, the major disadvantage comes from the fact that academics is not there, and in case of surgery, the surgical cutting is not there. Now, what if a hospital is known that it is good in academics? Even a corporate hospitals are known for publishing excellent research. Medanta, Gangaram, even Apollos, these are hospitals at the same point of time. They are private hospitals, but they are known to have excellent academics. They are known to publish the research. They are known to have a good training program. In these scenarios, DNB at these places is actually good enough. In fact, maybe even better than MD for a comparison. I'll just add a disclaimer at this point of time that my knowledge is secondary. All I have known, or I'm trying to tell you is from what I have gathered myself from other people who are working at the center. So always, yourself go and ask you how is the DNB program at the center. That will be your first hand knowledge. Mine will be a second hand knowledge. So always take my opinion with a pinch of salt. Now, as far as pediatrics is concerned, I'll give you the list of the good colleges: Holy Family, Gangaram, Saint Stephen, Chacha Nehru. That these in Delhi, and in case of Mumbai, PD Hinduja, Lilavati, KEM. See, as you can see, all these are private sector hospitals, but they're excellent big private sector hospitals with excellent academics. So the one distinct disadvantage of DNB, that academics are less, goes away. Since academics will be better, your pass percentages obviously will get definitely improve. At the same point of times, like I told you, the teaching jobs scenario also, since there are more than 500 bedded hospitals, the teaching part is also cleared off. So if in a scenario you're not at your rank, you're not getting an MD in pediatrics, or you're getting an MD in pediatrics at a place far away from your home, but you're getting it in Delhi, you're getting a DNB in pediatrics at, let's say, Holy Family, Saint Stephen's, Gangaram, Chacha Nehru, Hindu Road. These are government hospitals, but they're not offering MD, but they're offering DNB. They're excellent choices. If your love interest is pediatrics, you want to become a pediatrician, that's what you always wanted to become, go for it. DNB at these places is excellent. Academics is good, decent enough at least, and you will... it's almost as good as MD, if my opinion is considered. Same goes for these hospitals as far as Mumbai is concerned. There are certain other hospitals for other cities as well, Kolkata and Chennai. You can search them online. I'm pretty sure you'll get a lot of opinion online, but these are my views. Especially for the Delhi, I can personally vouch because I know my colleagues, I know people who come from there, I know the activities that are going on these colleges. So yes, if you're getting an DNB in pediatrics at these hospitals, Saint Stephen is an excellent hospital. Chacha Nehru Bal Chikitsalayah is an excellent government sector hospital with excellent patient load, with good patient load and a good amount of teaching that you can learn. So even if you're getting DNB in pediatrics but not getting MD in pediatrics, or getting MD in pediatrics at a far away place, go for a DNB in pediatrics at this place. You won't mind. Same for radio. Radio, in fact, is a branch that I'll actually say. The big private sector hospitals, they are known to have all the latest machines. They'll have their MRIs, they'll have their latest technology and everything. There are many government hospitals where you won't have an MRI, so you won't get any first-hand exposure of MRI. So in such a scenario, DNB at radio at a Delhi corporate hospital, which is all these facilities, maybe actually be preferred as compared to MD at radio at a place which is at periphery and has bond. And that is the reason the DNB at these places actually goes below 1K rank or even 2K rank. At these ranks, you can get an MD in radio diagnosis even at a peripheral college, MD in a very peripheral radio diagnosis, but then you have to give bond, or you will have to serve. They are in places where you wouldn't like to stay, or far away places from your home. In such a scenario, doing your DNB in radio diagnosis from a Delhi college is obviously preferable as going to do for MD radio diagnosis, especially if your interest is just private practice. If your interest is not into getting into a government teaching position, like I said before, DNB radio actually can be considered better than MD radio because of this one particular reason, that many government hospitals do not have MRI. This is a sad reality of our country, that many government hospitals do not have MRI. You won't be learning about MRI. If your interest is radio diagnosis, then go for DNB radio diagnosis if you're getting it in a Delhi hospital, Delhi big corporate hospital, or any big corporate hospital in a big city, Bangalore, Chennai. I can give you a personal example. I have a senior who did his MD in lab medicine from AIIMS. Then he again appeared for All India for the NEET PG examination. He secured around 9K rank. In the open counseling, he got DNB in radio diagnosis in Apollo, Bangalore. So he went for DNB radio diagnosis at that point of time because his interest was in radio diagnosis. But the main point was he always wanted to do private practice. So look at him. He can set up a center which has both pathology as the diagnostic services and radio, because he has expertise in both of them after doing your MD in lab medicine and doing your DNB in radio diagnosis. So that was his goal plan, and that's something you can also consider later on. I'll not advise this for everyone. Don't go for the 6-year thing. Just came into the mouth. But yeah, DNB radio diagnosis at a private hospital, good private hospital, a big private hospital, which is all these modalities, can be preferred over MD in radio from a peripheral college which does not have these facilities, which has a larger amount of bond, which will be away from your home. Last, DNB at any armed forces medical services, Army RR, command hospital, like I've said in my previous video, is excellent. So all in all, I'll say DNB obviously as compared to MD, slightly lower down, because academics is slightly suffers, your pass percentage is low, slightly higher fees, teaching positions are not available. But since the degree is considered equivalent, if you're getting it at a place, you're getting a branch of your choice, more and most importantly, your branch of your choice at a place like Delhi, Mumbai, at a rank where you won't be getting MD, go for DNB, especially for these options for medical fields. Like I said, medical field, not surgery. Please try to avoid surgery, especially for the medical fields. I have spoken about certain hospitals. You can do your own research. You can talk to the people in this hospital who are doing their DNB in pediatrics, radio, and other fields. Know from them the first-hand experience, know from them the first-hand information, and you'll be able to come to a decision. Thank you.